Hi everyone. My name is Mystica Lawale, a healthcare consultant, and we're talking about something interesting today. Yes. So I'll be telling you the 5 things that you do that kills your kidney. So the first one is overusing painkillers. These painkillers inhibit a certain substance known as prostaglandin, which is a kind of hormone that helps in healing process. And in this sense, the pain reliever or the painkillers reduces the secretion of this prostaglandin. And how does this happen? It reduces the blood flow to that area where there is pain or wherever there is injury or whatever. And so how does this affect your kidney? When there is a constant reduction of blood flow, it affects the small vessels in your kidney, and this damages your kidney over time. And this is why you should minimize or reduce the overuse. And second one is antibiotics abuse, like abuse of antibiotics. This can pose a kind of threat to your kidney because these drugs, whenever they are broken down, some of the constituents have been excreted out of the body, and these constituents could accumulate into your kidney, and this could now become toxic to your kidney and make your kidney overwork itself, and over time your kidney starts to malfunction because your kidney is overworking itself, it has stressed itself, and then it starts to malfunction, and it could now lead to kidney injury or kidney diseases, and over time it could lead to chronic kidney disease. The third one is salt intake. Salt is a kind of substance that you need to generally reduce the intake of salt in every of your diet. Like even if you are not at the risk of having hypertension whatsoever, you need to reduce your salt intake because this could pose a kind of threat to your body system, in the sense that salt contains sodium, and sodium is a kind of substance that draws water into the cells. And when this happens, it tends to exert a lot of pressure on your kidney because of course it filters waste out of the body, filters water back to the body, and if there is accumulation of fluid in the body, then there is problem because your kidney is now overworking itself to excrete excess water out of the body. And this is why you need to reduce your salt intake or any kind of process. The third one is herbs intake. This one as well, if you are to take herbs, make sure you take herb in the appropriate portion, like herbs that you could measure the quantity for you to make use of. I made a video on the misconceptions about herbs and medications. You should check my YouTube channel. There is a video addressing that. So if you're to make use of herbs, you either go for herbs supplement, or you make sure whatever herbs you're taking, it was or it is administered to you by your healthcare provider. Yes, and in this sense, your healthcare provider will tell you the appropriate quantity for you to consume. If not, if you're consuming a lot of herbs into your system, you're giving your kidney extra workload. And then the next one is smoking. Yes, smoking naturally is not good, in the sense that it reduces the blood flow into the body. It tends to affect the function of the kidney because the kidney needs the blood for it to perform its functions of filtration, because the kidney filters blood, takes water back to the cells that are needed, and takes out the toxics from inside of the blood. And when this is done, the kidney is able to do its filtration properly. But when you need to reduce the blood flow that the kidney needs for it to function appropriately, and this affects the functions of your kidney. Now, how do you now know your kidney is at the risk of getting damaged? How do you know? Here are the warning signs of kidney damage. Itchy skin, because of the accumulation of toxins in the body. Then your urine gets foamy. Foamy urine or brown urine or a bloody urine is a sign of kidney damage. Then another sign that your kidney is getting damaged is when you have a bad breath. Like you just perceive such person is beginning to have a foul breath, like it smells kind of like rotten thing. Then another sign is poor sleep. Such individual tends to find it difficult to sleep, and in this sense is either they have the urge to urinate and they can't urinate, or there is an accumulation of fluid in the body. It says that the body is having a kind of disruption in that process. Then you must be able to find 2 to 3 or 4 or every other signs for you to be sure that yes, such person is suffering from kidney damage. And so that will be all for today. Please subscribe to my YouTube channel. Thank you.